Greetings from Indian Journal of Anaesthesia. I, Dr. Kushbu Pandey, will be presenting an original article from July issue of Indian Journal of Anaesthesia. Comparison of incidence of sore throat with laryngeal mask airway protector and laryngeal mask airway ProSeal, a randomized clinical trial. Supraglottic airway devices are now preferred for short duration daycare procedures under general anesthesia. Post-operative sore throat, that is POST, is a common complication with supraglottic airway devices, and it can cause significant patient distress in the perioperative period. Many risk factors are associated with POST. Among these, one potential modifiable factor is intracuff pressure. Higher cuff pressures by causing direct compression can impede the mucosal blood supply, leading to ischemia. Among the newer generation supraglottic airway devices, LMA protector is a disposable pre-shaped LMA made of silicone with dual gastric channels, which gives a higher oropharyngeal sealing pressure, that is OPSP. It also has inbuilt cuff pilot technology, which is color-coded facility, and it facilitates continuous monitoring of intercuff pressure. We hypothesized that incidence of POST will be lower with LMA protector than with LMA ProSeal due to continuous cuff monitoring facility. The primary objective was to compare the incidence and severity of POST with the use of LMA protector and LMA ProSeal. The secondary objectives were to compare the device insertion time, first attempt insertion success rates, ease of insertion, OPSP, and ventilatory parameters in each device. The study was approved from the ethical committee by the institute and registered under CTRI. It was a single-center, double-blinded, parallel group, randomized controlled trial, which included patients of 18 to 16 years of age with ASA physical status 1 and 2, undergoing elective surgeries lasting up to 2 hours, requiring general anesthesia with supraglottic airway devices. Whereas patients at risk of aspiration and a recent upper respiratory tract infection history were excluded from the study. There were two groups. The protector group, that is group PT, constituted 59 patients where LMA protector was used to secure the airway. And there was a group ProSeal where LMA ProSeal was used to secure the airway, named as group P, constituting 59 patients. The sample size was calculated based on previous study where the cumulative incidence of sore throat among patients was 42%. Expecting a reduction in overall incidence of sore throat in LMA protector at 24 hours to 16%, the minimum expected sample size was calculated to be 108, that is 54 in each patient, 54 patients in each group with a power of 80% and an absolute precision of 5% by using OpenFD software. And after considering a dropout rate of 10%, the corrected sample size was 180. Statistical analysis was done with SPSS version 19. The primary outcome was to compare the overall incidence of sore throat with LMA protector and ProSeal. So the outcome was found out that the overall incidence of sore throat was 28% with LMA ProSeal, which was significantly higher than that of LMA protector, which was 12%. Regarding the secondary outcome, the time taken for insertion was significantly higher in LMA protector, that is 37 seconds versus 23 seconds in LMA ProSeal. The first attempt insertion success rate of LMA protector was 81% and second attempt success rate was 100%. Whereas in case of LMA ProSeal, the first attempt success rate was 100%. The ease of insertion was graded as easy in all patients using LMA ProSeal, whereas it was 81% and had easy in LMA ProSeal, and 18.9% has moderate difficulty with LMA protector. Blood staining was noted in 8.6% in group PT and only 1.69% in group P. The mean SD of OPSP of LMA protector was 33 centimeters of water, which was significantly higher than that of LMA ProSeal, having 27.7 centimeters of water. However, end-tidal carbon dioxide concentrations and peak airway pressures were comparable among both groups. So these are the results. Regarding the demographic characteristics, they were comparable in both groups, and the surgical duration and insertion of parameters have also been provided by the authors. Regarding the primary and secondary outcomes, we can see that the authors have described that oropharyngeal ceiling pressure was significantly higher in protractor group, that is the p-value having 0.005. Also, the ease of insertion was easier in group ProSeal, that is 100% patients had easy intubation in the first attempt. However, the end-tidal concentrations of carbon dioxide and peak pressures were comparable among both the groups. Therefore, the usage of LMA protectors significantly reduced the incidence of postoperative sore throat and pharyngolaryngeal symptoms compared to the LMA ProSeal in adult patients undergoing surgical procedures of less than 2 hours. The incidence of dysphagia was also found to be lower but comparable. LMA protector is a newer second generation LMA made of silicon with a novel cuff coilet technology. This gives the device an added advantage over other second generation supraglottic airway devices, as high cuff pressures are a risk factor for postoperative sore throat. The authors inferred that the longer insertion time noted in LMA protector can be due to its larger size and lack of experience with the device. LMA protector had a favorable profile regarding postoperative pharyngolaryngeal complaints despite some difficulty in insertion and can be considered a suitable option for an SGA in short duration procedures. As a limitation, the study population mainly consisted of female patients without difficult airway predictors. In addition, all patients received neuromuscular blockers, which can impact the overall incidence of sore throat. The experience with using the two devices was different, which could have impacted the first attempt success rate and time of insertion. Additionally, the inability to blind the performance could affect the insertion parameters as well. In conclusion, LMA protector with its continuous cuff monitoring feature is better than LMA ProSeal regarding postoperative sore throat and other pharyngolaryngeal symptoms. Thank you.